Pope Francis has been discharged from Rome's Gemelli hospital after a prolonged stay of more than 5 weeks, marking a significant milestone in his recovery. The 88-year-old pontiff had been hospitalized for pneumonia in both lungs, a condition that placed him under intensive care for a period. On Sunday, the Pope made his first public appearance in weeks, waving to the crowd from his hospital window. Seated in a wheelchair, a device he has used for several years, Francis appeared in high spirits as he greeted the well-wishers who had gathered to see him. "Thank you all," he said, his voice resonating with gratitude before he waved once more. In a touching moment, the Pope made the sign of the cross to the crowd before being escorted back to his room. Moments later, he was seen leaving the hospital in a car convoy. On his way back to the Vatican, he made a brief stop at the Papal Basilica, taking a moment to pray. Although he did not deliver his usual Sunday prayer, the Vatican released a statement from the Pope where he reflected on his time in the hospital. "In this long period of hospitalization, I have had the opportunity to experience the patience of the Lord," Francis wrote, extending his appreciation for the tireless efforts of the healthcare workers who cared for him and the prayers of the faithful. He also expressed deep sorrow over the ongoing conflicts in the world, including the resumption of Israeli bombings in Gaza, and welcomed the peace agreement between Armenia and Azerbaijan. The Pope's recovery has been a topic of global interest. His doctors confirmed that, on 2 occasions, his life had been in danger, but that he had stabilized in recent weeks. His health journey required him to receive high-flow oxygen therapy at times, and he will need 2 months of further rest to fully regain his strength. Despite the setbacks, Pope Francis remains devoted to his duties, having maintained his commitment to the Catholic Church throughout his hospitalization, even calling the parish in Gaza nearly every night to offer support. While he has missed significant events like the Church's Holy Year celebrations, there has been no official word on whether he intends to step down from his papacy. This recent hospitalization follows previous health challenges for the Pope, including surgeries in 2021 and 2023 for diverticulitis and a hernia, respectively. His strength and unwavering faith continue to inspire millions around the world. As Pope Francis now returns to the Vatican, he will spend additional time resting and recovering before resuming his role as the spiritual leader of the Catholic Church.